Welcome back. Now, patients and staff at Kalafong Hospital in Atteridgeville have been affected by protest action outside the hospital in recent weeks. Members of Operation Dudula picketed outside the hospital against unregistered foreign nationals receiving health care. Let's unpack the impact that this has had on nurses. Sicina, the president of the Young Nurses Indaba Union, joins me now in studio to tell us more. Let's just start with what happened last week, right? It's been a ripple effect. Last week, for instance, you had the MEC of Health in Limpopo, Papira Matuba, on video telling a Zimbabwean national who apparently was here illegally that, Zimbabweans are overburdening the healthcare system. Do you agree with these sentiments? I mean, you're a nurse, so you're on the ground. So I invited you for you to just give me a picture. Do you agree with these sentiments?
Thank you, Masego. Good afternoon to the viewers and everyone. We agree. We agree with what Pupi was saying. Our public healthcare system in particular is overwhelmed. It is overwhelmed. When I'm talking about such issues, Masego, is that I'm a nurse and I'm doing the bedside nursing. I usually make an example. We once admitted about 52 patients in a 45-bedded ward. Obviously, we have to create beds in between other beds. We put stretchers in between beds because the ward has reached its capacity. And I decided to count because we are all frustrated. We are grossly understaffed. There's gross shortage of material resources. So I decided to say, today I'm going to count. We usually never count to say this is a foreign national. Do they have documents, papers and stuff like that? But on that particular day, 52 patients in a 45-bedded ward, I sat down and counted to see that like about 55 or 60%, 28 patients were foreign nationals. All of them are undocumented. It was not only happening in my ward. Go to any medical ward, any surgical ward, any neonatal ICU, adult ICU. The system is actually overburdened. To remember, all these healthcare facilities that we are using and utilizing at this democratic dispensation were built way back during apartheid system, and they were built to cater for the population at that moment in time. Then here, democratic dispensation, our borders are porous. Everyone they get in, and some of these some of our fellow brothers and sisters from different countries, Zimbabwe, Mozambique, they actually tell us as nurses to say we came here because we couldn't pay in Zimbabwe. It's difficult.
So
we don't have money. We came here in South Africa because everything here is for free. Remember, when you go out there, I always make an example to say before we throw stones to whoever is raising this, it's a very sensitive issue for that matter. But let's say you go there, your mother is sick, you really need medical assistance. Maybe you just need to go to ICU, but you can't go to ICU because ICU is full. And in that particular ICU, we have 15 patients. Out of those 15 patients, 8 of them are foreign nationals, undocumented. So we are going to turn back a South African. A South African is going to die on that stretcher in casualty.
So that brings me to my next question then. You know, there's a fine line between what you're saying in agreement to the MEC, etc., and people who are obviously having the sentiments that, if you're in a country illegally, it's a criminal offense. So how do you draw the line? Because as a nurse, for instance, you took an oath that you will save lives, no matter who it is. So where do you then draw the line? How the frustration around that?
We were talking about it on our social media platforms. We always talk about it every day. That is why it's so difficult to be a nurse. To do what we are doing, it's not everyone who can do it. That is why we are actually saying that we need to revisit our constitution. Our constitution we need to talk to Section 27 of our constitution, because it's the one that says everyone who lives in South Africa, whether we are documented or not documented, whether we are a South African or not South African, as long as we are in this country, you should never be denied healthcare system. You have a right to access our healthcare system. Then that is why we were at some point in between the hard place and the rocking as far as articulating what actually Poppy was saying, because we are, as nurses, there's some form of we need to maintain professional conduct, and there's ethics involved as well. To say, was the platform right for Comrade Poppy to say that? Did the way she did it, Was it actually
necessary?
Right? Was it really necessary? Then the question is, but us, when we are putting it, when we are saying it, like without in those in the right platforms, nobody listens. As a result, even when Comrade Poppy was saying what she said, we viewed as a cry for help. If someone in a position of authority, a doctor for that matter, because even if it's an ethical dilemma that we face every day. What then do you do if there's a foreign national on an ICU bed, or there's a foreign national undocumented for that matter in a bed, and you have to turn back a South African? Who do you choose?
So do you agree with Gayton McKenzie's sentiment earlier this week, saying that he would rather switch off the machine of a dying foreign national to save a South African?
It kills your, I'm a nurse. I've seen people dying in our line of duty prematurely because of gross shortage of staff and gross shortage of material resources, because we can't divide ourselves as doctors and nurses and save everyone. We've seen in labor ward patients a complete mess in our maternity and clinics for that matter. So it will kill your conscience, it will kill your spiritual standing and your emotional standing to unplug, remove a human being from a bed. Remove a human being because that particular person is a foreign national and put a South African. Yes, somehow we can say, yes, we are saving a South African who is actually working for that matter maybe and contributing to the economy as far as tax is concerned. But because you can, there's a plethora of reasons. But just make it practical. Remove a person and put the other one. What then will happen into you are literally killing.
Yes, literally you'd be a murderer, right?
Exactly. We are literally. But I always say in our Y2 corridors, we always say the system, our public health care system, those in positions of authority, politicians in particular, are using nurses in this country and doctors, nurses and doctors, and actually all healthcare workers as accomplices of murder. You know, when Gayton McKenzie is talking about removing a person so that we can put a South African, it's something that we actually do it almost every day indirectly, and we don't talk about it. What then do you do when there is a patient on the floor because there's no bed? And you can't divide yourself into 5 nurses and you have to choose who to save. Go to any labor ward in this country, go to Para, go to Telemukwerane, and go to Prince Mshieni and witness chaos in our maternity ward, where one professional nurse, we have to look after 3 women who are bearing down. Who do you choose to save?
Yeah.
What if the one we are not choosing is actually one who's going to come and amend the constitution of this country?
Yeah, it's quite a difficult daily struggle that you have to face. But now, recently at the Kalafong Hospital, Operation Tudula outside the gate, basically literally stopping foreign nationals who, for instance, couldn't provide the proof that they are here legally and turning them back when they need assistance. Do you agree with what they were doing?
You know, here, I always say behind every behavior, there's a reason. I'm a nurse. When a person comes, we do our assessment and follow proper procedures and actually come up into a final diagnosis. Because if you are failing to diagnose, the patient, they are going to prescribe wrong treatment. That is actually what is happening in South Africa. Yeah. And it's not everyone who's brave enough to stand in a space like this and say, our politicians, ANC in particular, they are the ones who created this mess. We are in this particular mess now because they have created it. And it's a sign that they are actually portraying a behavior that they are failing. They are actually saying to all of us, they have failed, they are failing, they will fail tomorrow. Something then, vigilantism will then emerge. When people can't follow the law, when you are following proper procedures in terms of grievances. We march, we hand over our memorandum of demands, we talk about our gross shortage of staff, we are earning poverty level salaries, we talk about all those things, but who listens? And then if no one listens, more especially those in positions of authority, that is what you'll see. Ahmad Tutula will do what exactly they are doing. But like it's it's when you think that South Africans we are forgiving and we are loving by nature as South Africans, but ANC has pushed us to a point where we see humans without humanity. Because yes.
A little earlier on, you made quite a strong statement. You said that government has made you basically an accomplice to murder as nurses, because every day indirectly you have to choose who to save and who not to save. There's a lot that you've been saying in terms of some of what nurses need at hospitals to be able to meet the demands of South Africans or the people that you serve. So will that be a solution, for instance, to this particular case? What's your plea to government, especially when it comes to, outside of the fact that already our health system is in tatters, and the fact that South Africans already are a lot? What would be your plea to government to sort out particularly this issue that is boiling now, almost out of control, to a point where people are even saying switch off the plug of a foreign national and put a South African on that bed?
At the moment where we are sitting, we don't have, the only solution is to go to the Constitution. Amend these laws. Let's fix our borders. But you can't fix the border without talking to the Constitution first. Talk to the Constitution, amend the Constitution. It must be clear, like the one in Zimbabwe, it's clear. The Constitution, in as far as accessing healthcare system in Zimbabwe, it's clear. They are actually putting it in black and white, saying if you are a foreigner, you are not going to be assisted in as far as even in as far as emergency medical care is concerned. We need to talk to that, because if, like, what else can you do at the moment, so that will actually give those in the front line in our healthcare facilities the powers to vet and actually put proper processes. Because people come into this, they come, you are a foreign national, you are undocumented, you don't even have money, but as healthcare workers, nurses and doctors and clerks and all healthcare professionals, there's nothing we can do. Because the Constitution says nurse this person, whether this person has money or not. So we need to talk our law. Let's talk to our Refugee Act, let's talk to our National Act, let's talk to our Constitution and actually empower each other in as far as this is concerned.
Yeah. Thank you so much for speaking to us, Rich Sicina. He is the president of the Young Nurses Indaba Trade Union, speaking to us there about issues around immigration in our country and the topic that has been boiling over. Let's